This is LAHRStv. I'm Juan Carlos Zerpa. We are in the LAHRS 2024 meeting, and I'm joined by the Vice President of the Heart Rhythm Society, Dr. Mina Chung. Welcome to LAHRStv.
Thank you very much. It's been wonderful to be here.
It's really nice having you here in the city of Cartagena. Tell me, how was your expectations to come to Colombia, to come to Cartagena, and to follow this Latin American meeting of the electrophysiology?
Well, to be honest, several of us had some worries about coming to Colombia, but I've been very, very pleased and surprised at the hospitality, the safety of Cartagena. And we took some tours a couple of days ago of the old town and learned very much about the changes that have been made. It's a lot safer. I don't have any of the concerns that I had before. So it's been wonderful, and the hospitality, the meeting, and the collaborations and networking.
How about the food?
The food has been great. It's very delicious, and just really enjoyed eating, probably too much.
It's been like 2 days of an intense meeting, all electrophysiology and devices. How do you think we are doing it? How is going from this?
The program has been great, and it's wonderful that we can do Spanish and English sessions and combined Spanish-English. You've had even a live case of AFib ablation. There have been a lot of highlights.
Yes.
Wonderful programs, and joint sessions have been really, I think, very successful, and really appreciate being able to do the HRS and LAHRS joint sessions
Great.
as well.
This collaboration work between the Heart Rhythm Society and the Latin American Heart Rhythm Society is being done for so many years. We have like 7 years that LAHRS was formed and officially working, and this work together with Heart Rhythm Society has been really important. What are your expectations, your evaluation from this collaboration work, and when can we expect from the future from this?
Yes, well, we had the Latin America Summit a couple of years ago. So a summary of that will be published very soon in the next few months. And I think that has been very, very valuable in registering and developing registries and figuring out the statistics, what the resources have been, what patient access may be to electrophysiology services. So I think the next step besides that is, besides what you're planning on doing and continuing updating the registry, is fantastic. But I think really what we want to do is take what we've learned from doing that summit and see what we can do that is actionable, that can make things better. How can HRS help Latin America Heart Rhythm Society really advance electrophysiology and access it?
We have these huge, extensive countries together, differences between country and country, and so many differences in laws and politics that we need to learn about it. But now we have a radiography, like a picture of how the situation is in every country. Some are doing so much in electrophysiology and so many new things, and some others are really back and that needs help to equalize the level between the countries. I know that you have this movement of advocacy in the HRS, and we want to learn from that, and maybe we can follow your steps and make some difference down here in Latin America.
That's what we hope too. We just formed the Heart Rhythm Advocates, which is it can be focused a lot more on political action as well, and advocacy for patients, patient access, for causes. That's going to be separate but related to Heart Rhythm Society, where the Heart Rhythm Society could do also advocacy, but there were some limits to it.
Yeah.
But we in the U.S. have had our issues as well with reimbursement, and a couple of years ago, our physician reimbursement got cut by 40% for AF ablation. So that has, we were unable to prevent that despite all we did. And then also currently there are other issues as well. And we hope that forming this advocacy group will help us address those in a more focused and fashion and take into the organization all the passion and energy that people have for advocacy. And I think we have a lot to learn from that process that I hope will be able to be applied globally, because these issues are not just in the United States, they're everywhere.
Yeah.
So we want to be able to support advocacy internationally in Latin America. And, for example, we could figure out where the challenges are. Are there scientific statements or other policy statements that we can issue that will help countries get reimbursement?
Yeah.
An example is remote monitoring, for
Yeah.
example. Coming out with a class 1 indication for remote monitoring.
But it's difficult to get this into the practice.
Yes, because it's not necessarily approved in terms of reimbursement everywhere.
Yeah.
But hopefully if we put those out there, then you could take those documents to your government or to hospitals. So that's where we hope it can be more applied globally.
If we have a common place, like the society that works for the doctors and his members, this is really important and really can make a difference. Next year, we're having the Heart Rhythm Society meeting in San Diego. When is going to be it?
It's in April, so we're toward the end of April. And so we look forward to having you and many others from Latin America and globally attend the meeting. Hopefully it'll be easier, a nice, easy location. It's a beautiful location.
Yeah.
So.
And next year, our meeting is going to be in Buenos Aires, Argentina, and we hope to see HRS crew.
Yes.
And all the members too are invited to come to Argentina and to visit us and to participate with this meeting. Together we are stronger, and educational is essential to get better.
Absolutely. We are not the largest specialty. We are a small subspecialty. We're all very, we're an amazing specialty, right, in what we do. We do amazing, intense procedures, but there are not that many of us in the U.S. or globally. So it's really important for us to all hang together, to be united, to be one.
Yeah. Dr. Mina, it was a pleasure having you here on LAHRStv.
Thank you very much.
And we are together with HRS-TV and LAHRS-TV. So we hope you have a great day. Thank you for watching, and don't forget to follow LAHRS-TV in our YouTube channel. Thank you so much.
Thank you.